All right, everyone, we will go ahead and get started. Well, good afternoon, and thank you for joining us today for our Lunch and Learn. Before we get to our speaker, I just want to mention a couple of our upcoming events. Our virtual fitness classes are still going on. They are all on Zoom. You can get the link for them as well as register on Link to Health. Our next Lunch and Learn will be September 25th. It will also be virtual, and it will be a cooking demo. And lastly, part 2 of the Staying Calm and Well webinar series is still going on. We just had week 3. So if you would like to join that, you can visit the website. You can see the link right up there. During the presentation, if you have any questions, you can put them in the chat box and we will get to them at the end. Now, our speaker today is Jamie Beadle. Jamie has been a physical therapist for over 20 years, spending the last 15 of those specializing in occupational health and wellness. He has provided direct physical rehabilitation services, helped workers prevent injury, and improve the health of thousands of workers across the state of Ohio. Jamie graduated from Penn State University in 1997 with a degree in exercise science, then attended graduate school at the University of Pittsburgh, receiving a master's in physical therapy in 2000. In 2007, Jamie became the first on-site physical therapist at The Ohio State University as part of what is now the Integrated Absence Management Team within the Office of Human Resources. Jamie helped to develop the university's transitional work program, which is recognized as one of the premier such programs in the country. Throughout his time at The Ohio State University, Jamie has performed well over 3,000 ergonomic assessments. He has helped everyone from the tenured professor to the line cook at the dining hall to maximize their ergonomics to keep them safe, comfortable, and productive. Jamie, I will let you take it away here.
All right. All right, I think we're good. Okay, so thanks a lot for inviting me to speak today, and I'm happy to kind of share some ergonomic tips and hopefully a little bit of education there to make the work environment a little bit more comfortable for people. So exactly what is ergonomics? So you may have heard of an ergonomic chair or an ergonomic keyboard, but what does that really mean? So pretty simply put, ergonomics is just the study of the relationship between a person and their work environment. And it really is this sort of relationship that we want to consider. It's not just the work environment or the work tools. So in this case, like a computer or a desk or something like that. It's really how those tools match up with the person. And that's why when you see like a chair or a keyboard or something like that advertised as ergonomic, really want to use some caution with that, because what's ergonomic for one person may not necessarily be good ergonomics for another one. It's really about that relationship of how the environment or the work tools fit the person that's using them. And that's one of the things that we really want to remember as we talk about ergonomics, is that we want the tools to fit the worker rather than asking the worker, the person using the tools, change to fit them. So if you or someone that you know that you're trying to help with ergonomics has to change like a lot of their posture, or they have to sort of contort themselves to use these tools, and you kind of think that, oh, okay, that's where we need to go, so we're going to put them into these sort of positions. It's really not a very good way to approach this. We really want to make sure that the tools are going to fit that particular person. So when we're talking about ergonomics for a computer workstation, the environment typically includes the chair, the monitor, and then the keyboard and mouse. That's really the main tools that we're working with. And these really work together as sort of a system. So we want to make sure that when we change one thing, that we take a look at everything else there too, because that could throw off some of the other things. So there's not really a single correct posture or arrangement of the components that's going to fit everyone, But there are really some basic kind of design goals that we shoot for when we're looking to set up a workstation a little bit better. And the main goal behind making some of these adjustments there is really to kind of eliminate discomfort, but even more than that is to really look at minimizing the chance of an injury. And when we talk about injury, we're mainly talking about what we term musculoskeletal injuries. So, this is really any sort of injury to the musculoskeletal system. So think of bone, discs kind of in your back, muscle, tendon, ligament, any of those sort of things. So, and there's a couple common ones that are listed on the screen there. So, from anything from a simple sprain or strain to a little bit more serious. So carpal tunnel syndrome, it's kind of some things like that. Those all kind of qualify or it's classified as those musculoskeletal injuries. Okay, so how do you know if you have one of those injuries, or what sort of things kind of point in that direction? So there's certainly degrees of musculoskeletal injury. So that may very well start out with just like a dull ache in part of your body. You may get a little jab of pain at a time, usually associated with movement, but then that sort of can progress down to things that are a little bit more concerning, where you have some numbness, you may have a loss of movement in a particular joint, you may notice a lack of strength in, say, your hand or something like that. Those are obviously a little bit more serious. But the big thing that we want to do here is we really want to pay attention to those early symptoms, because those are usually a pretty good indicator that something else is going on. And if we can catch those and treat those or make adjustments to kind of get rid of those symptoms early, we're usually a lot more successful in terms of heading off any long-term problems. Okay, so there's degrees of these musculoskeletal disorders. So minor injuries or minor problems, usually pretty quick onset. So you've just had those for a couple of days or a couple of weeks, and you may have some pain while you're performing an activity. So if we're thinking about a computer task, maybe you're having some pain in your elbow every time you use your mouse. As soon as you stop using your mouse, pain goes away. And that's what I mean by that last state, or that last line there, is that the symptoms are generally going to improve when you change that activity. Okay, so the treatment for this is, the kind of old standby of rice, rest, ice, compression, elevation. There's a little bit of controversy whether ice is really appropriate or not, but regardless, that's usually a pretty good basic strategy to start with, just kind of to treat that injury just sort of yourself and kind of manage it using those kind of principles. But here we really want to manage our activity level a little bit. So look at trying to change activities that are bothersome a little bit, or at least modify them to make that a little bit less stressful to that particular body part that you're having problems. And then when we're talking about work activity and ergonomics, really want to look to complete some ergonomics training to try and set up your work area a little bit better. So this sort of talk today will certainly kind of fit in that category. And then there are some resources that we have at the university that I'll go into at the end of the presentation that you can certainly look at as well. Okay, so the next stage of the musculoskeletal disorder is that pain is a little bit more persistent. You may notice that like when you stop that activity, that pain doesn't necessarily go away. It may linger for a little bit. Like, so for the rest of the day, you have that pain in your elbow. Next day, you're pretty good, but pain is definitely going to linger a little bit more. At this point, you may start to notice that you're not quite as efficient as you were. So it might take you it might take you longer to complete the same amount of work here, or you might notice that you're not able to work as quickly as you once could. So you might start to see some declines in productivity here. You also may start to see some of those signs of the musculoskeletal, those signs on the bottom of the musculoskeletal symptom chart that we looked, or page that we looked at. So those ones towards the end of the arrow, we might start to notice that, where we start to have a little bit of numbness or tingling or those things. It's usually an indication that things are a little bit more severe. We still want to go ahead and treat those as best we can, kind of, using the Rice principle there. And at this point, we might want to look at having someone come out or someone take a look at your the ergonomics in your setup to see if there's anything that can be done. You can still do the training and try and look at it yourself, but at this point, you know, it might be good to have another set of eyes look at that. Here too, it's also probably a good idea to consult with your healthcare provider, just because these types of injuries tend to be kind of nagging for a while, and then they just get to the point where they're sort of unbearable. And if we wait that long, they're a lot harder to treat than if we kind of did it at the beginning. So trying to involve your healthcare provider at this point is probably a good idea. And these types of injuries, or this stage of musculoskeletal injury, typically do respond pretty well to conservative treatment. So whether that's rest, maybe some work restrictions, or you know, maybe a little bit of physical therapy, typically these injuries respond pretty well to that. And then the last is when those injuries have progressed a little bit more. Obviously, they're a lot more pain here. That pain typically doesn't go away, so people are in, you know, constant or near constant pain. Pain at rest. A lot of times they're going to have disruption in sleep. You know, and some of those more severe signs and symptoms that we talked about there. So here we certainly want to consult with a medical provider. You know, they really should be the ones that are directing that treatment plan from top to bottom. So they might recommend an ergonomic assessment, they might recommend some other things at work, but we certainly want them involved in sort of directing that whole care. Okay, so talking about what are risk factors of musculoskeletal disorder. So there's mainly 5 risk factors that we want to talk about. So, and this is for any type of musculoskeletal disorder. So you know, when you have a high force or effort, and a lot of times this is associated with like pushing, pulling, lifting, that sort of thing. Not really things that you associate with an office environment, but high force can also be, you know, putting a lot of force through your hand. So depending on keyboard, mouse, kind of that sort of thing, you can put a lot of forces through your hand, and that high force can contribute to injury. So the next risk factor is what's called awkward posture. So this is just, you know, at a given joint, if you work away from sort of the middle range of motion of that joint, the further you get to the end, the more stress you put on that joint, and the less efficient movement it's able to produce. And so this sort of extreme positioning can really stress the joint tissues, kind of potentially reduce blood flow, and lead you to an increased likelihood of injury. So the next one is what we term sustained posture. So this is really just working in the same position for an extended time without a break. So you know, if you're not able, or you kind of just not in the habit of moving frequently enough, just working in a solitary posture or a pretty similar set of postures can lead to some increased risk of an injury there. Contact pressure, you know, that's pretty self-explanatory. It's just the pressure of a part of your body on a hard surface. So think of like in the office environment, if you are resting your hands in front of the keyboard on a hard desk, that hard pressure there of the desk puts you know, a little increased pressure right over the carpal tunnel area of your wrist, can lead to an increased likelihood of injury. And then the last one is high repetition. So just doing the same thing over and over again, especially if you're not able to kind of break it up at all, that can be a problem. All right, and so the thing with the risk factors is that they're what we term multiplicative, and they're not necessarily additive. So basically what this means is that the more risk factors you have, the overall injury risk that you have goes up substantially. So it's not like if you're working in an awkward posture and you have to stay there for a while and are unable to move. It's not like you have 2 risk factors, so 1 + 1 is 2. It's more like 1 + 1 is like 4 or 5 or something like that. And the reason that that's kind of important there is we're looking at reducing the overall injury risk, because it's probably pretty unlikely that we're going to be able to eliminate all of the risk factors. But if we can reduce some of them, or maybe even take one away, we're going to significantly decrease the overall risk of injury. Okay, so just kind of looking here, it's a little tough to kind of make it interactive here as we go, but try. But so just looking at this picture here, see if you can kind of pick out a couple of those risk factors that we might see in terms of this particular person at the office. And again, they're listed out there on the right. So for sure, he's got 4 of them. You know, we don't really know, you know, the force that he needs to use the keyboard or the mouse, so we'll discount that high force. But certainly he's working in a pretty awkward posture. If you kind of look here, you can sort of see how his wrists are sort of flexed up, so definitely away from that neutral posture there. Sort of in the shoulders, the neck's kind of forward, his shoulders are starting to round a little bit. You can even, can't really see it too well in that picture, but you can start to see position his lower back's in. None of those are what we consider a neutral posture, so it's starting to get away from that that sort of baseline that we'd like to see him in. You know, again, we don't know for sure, but probably working in a sustained posture, so not really moving from there very often. So, you know, being stuck in one spot for a while, certainly going to increase the risk. Repetition, that's a tough one to kind of get rid of with computer work, just because, you know, we're doing a lot of mouse clicks, we're doing a lot of keyboard strokes. Some people, you know, several hundred a day at the low end. Some people are several thousand keystrokes or mouse clicks in a given day, so definitely a lot there. And then contact pressure for sure, we're seeing that kind of in the wrist and hand there, right there on the desk. Okay, so he's got a lot of kind of things going on, but honestly, it would be pretty easy to kind of get things adjusted for him and just get him in a much better position. Not only would it make him more comfortable, but it would certainly make it less likely that he, or it would greatly reduce his risk of injury there. Okay, so now we're going to jump into actually how we make some of those adjustments and how we look to improve the overall setup to decrease that risk. You know, one of the things, or the first thing that we're going to talk about is the chair, and that's kind of where I always recommend that you start. And, you know, some chairs are pretty adjustable. Some chairs really have no adjustability. So, you know, that's something to keep in mind. We'll talk a little bit about things you can do if your chair doesn't have a lot of adjustability. But one of the things that you can do is certainly figure out how to use your chair. Now, you know, if you are in an office, or even if you're at home now, you know, you might, it might be worth your time to kind of sort of figure out what type of chair you have, and then go online and look for how to adjust that chair, because a lot of times they do more than people think. So, you know, most people know how to do the height adjustment, but there might be some more capability to your chair than you realize, just because some of them have so many knobs you can't really figure out what which one does what. But most of the companies will provide like an adjustment card or something like that you can look at. Okay, so when we're talking about the chair, the first thing that we want to do is we want to adjust the chair height. And believe it or not, this can be a little bit more difficult than you think. Really, we want to set the chair height to the appropriate height relative to the desk surface. So most of the time, desk surfaces aren't height adjustable. I mean, you know, standing desk and that aside, many people don't have access to that. So if your desk isn't adjustable, what we want to do is adjust the chair to the desk height. So really what we're looking for is that your shoulders are relaxed at your sides. So being careful that, you know, the shoulders aren't shrugged up, or, you know, you're not kind of being pulled to one side or the other, but really nice and relaxed posture at your shoulder. And then your elbows are bent just a little bit more than 90 degrees. So you can kind of see in this picture. So if you imagine 90 degrees would be straight down our side and then coming out with the forearm parallel to the floor. It's just a little bit ahead of that, or a little bit greater than that 90-degree angle there. We want your elbows slightly open there. you know, if we can in this position, we want to try and get your thighs parallel to the floor. It might be necessary to use like a step stool or a box or something like that to get yourself in that position, but we certainly want your feet supported on something firm as you sit. So she's actually in a pretty good posture. So shoulders relaxed, elbow a little bit open, you know, forearm parallel to the floor, so that the wrist is nice and straight. So we know that you know that's adjusted well in terms of her desk height. And when we're looking at the wrist there, we want your wrist to be fairly flat, not really sloping up or down. Okay, so the next thing we want to do is we want to try and adjust the seat depth if we can. So in this one, a lot of chairs have this adjustment, but this is one of the ones that seem hidden for people. So it is worthwhile to see if your chair does have this adjustment feature. So in the first one there on the left, you can kind of see that the seat depth is too short. So in the way that you can tell that is there's this big gap between the back of the leg and the front of the seat there. So in this case, we're not going to get enough support to your legs, and that's going to kind of, the weight of your legs is going to sort of pull you down, and that's going to put more strain up through the rest of your body. In the second one, the seat depth is a little bit too long, so we're actually getting some pressure from the front of that seat in the area behind the knee there, and that can be a little bit sensitive for people at times. You know, you have some blood vessels and some other things running through there, so we certainly don't want to keep that pressure on it long term. And then the last one is sort of what we call just right. So that's the Goldilocks there, is we have just a little gap between the front of that seat and the back of your legs. So that's going to give you enough room that you're not compressing any of those blood vessels, but also make it that you have enough support for your legs. So that's if your chair adjusts, but you know, some chairs don't adjust, especially now a lot of people are working at home and might not have even the chair that they had at their office. So if you don't have any sort of seat pain adjustability at home, and you do need to get a little bit more support one way or the other there, if the seat is too short, meaning that your legs aren't supported enough, you can use a foot stool or a ream of paper or something like that, just to get your feet up off of the floor a little bit. That'll and really try and get your thighs more parallel to the floor. That will just give you a little bit more support and kind of take some of the pressure off of you. If the opposite is true and your seat's too long, you can do the same thing. Just kind of use a footstool. You'll get sort of the same benefits there of taking some of the pressure off. In this case, it will be off the back of your knee. But you can also decrease the depth of your seat by placing a blanket or a large pillow in the back of your chair, so that you're kind of pushed forward a little bit more in your chair. But just make sure that whatever you choose to put in the back there, it covers the entire backrest of the chair. You don't want to have this tiny little pillow just around your back pushing you forward, but then you can't use the backrest of the chair. So that's why I typically will recommend to people that they use like a large blanket or something like that covers the entire backrest of the chair. All right. The next thing we want to do is try and adjust the backrest. And so kind of contrary to what your mother might have told you is we don't necessarily want to sit up straight when we're working in front of a computer, especially if we're going to be there for a while. We actually want to sit with a little bit of recline to our chair. So this has actually been shown to decrease the amount of stress going through your spine. And then it also puts your shoulders and your head and neck in a little bit better posture when you do have to work. So in this first picture, you know, we're right around 90 degrees, so kind of sitting straight up. And that's not exactly where we want to be. In the second picture, you can kind of see that we're reclining way too much. This is a better position for your back. It's going to certainly be a little bit more comfortable, but from here, it's very, very difficult to kind of reach forward to access the keyboard and the mouse. And it's going to put a lot more strain on your shoulders. In this position too, it's also going to force your the muscles in your neck and the muscles that support your head to work a little bit harder to as you sit. So it might be better for your lower back, but it's going to put a lot more strain in other places. And then this last one is just right. So, you know, we have the angle between your thighs and then your torso is a little bit more than 90 degrees. So it's going to take some of the strain off your lower back, but it's not going to push you so far back that you can't access the keyboard and the mouse easily. Okay, so the next thing that we want to do is talk about adjusting the lumbar support. So if your chair has it, and sorry, the lumbar support is the support for your lower back. So not a huge fan of this picture, but you know, this red spot on the right there would be the lumbar spine, and that's basically just the 5 lower vertebrae in your back. And normally, when we're standing, we have a curvature to that, and then when we sit, that curvature sort of goes away, and we want to try and get back into that curve as we sit. It's just a little bit better position for your spine to be in, and decreases some of the strain throughout your lower back. So if your chair has it, typically I'd recommend to people that they try and max out this support as much as you can. If your chair does have this feature, we want to make sure that it's in the right spot. So really the bottom of this curve in your lumbar spine starts basically just below your waistline and then goes up to about your bottom rib. So that's where we want to have this support. You know, in some chairs you can actually adjust either the position of the lumbar support, or you can adjust the whole backrest just by lifting up on the backrest. You can change where that support is. So you can kind of see in this next picture, this chair did not really have a lumbar support, so she kind of used her own. So you can kind of see where that hits, just, you know, right around her waistline and then up a little bit higher. But you can also really see in this picture that that she still has her shoulder blades in contact with the backrest of the chair. Because a lot of times what I'll see people do is they'll put a pillow in here or support in here, and then they'll not sit back against it. So really what you want to do when you use one of these supports is you want to push your bottom in the chair back as far as you can, then put the support in, and then you want to sit back almost like you're trying to extend over the support, and allow your shoulder blades to rest against the back of the chair. Almost feels like your belly button's getting shoved forward, and that's kind of what you want to do. It might, you know, feel a little uncomfortable at first, but most people adapt to this pretty quick, and then once they feel it, feel how it's supposed to, or feels the support that it's supposed to give you, usually is a much more comfortable position. So that's what you want to keep in mind with the lumbar support. And the link there on the left is, it's actually just a quick little YouTube video on how to make a lumbar support. So, you know, because a lot of chairs don't have one, or the ones that they have aren't really all that great. They don't give you a lot of support. So just by using like a bath towel and rolling it up, you can make your own support pretty easily. And that just kind of gives you a quick little tutorial on how to do that. Okay, so that's about it for the chair. So kind of our checkpoints here that we want to hit is, the first thing we want to do is make sure we get the height of the chair right. So elbows bent right around or a little bit above 90 degrees, and making sure those forearms are parallel to the floor with your wrists straight. If your feet don't touch the floor, you know, consider using a footstool, small box, ream of paper, anything like that. We want to make sure that we sit with a slight recline in our seat. So we don't want to necessarily be sitting straight up or leaning back too far. And then we want to make sure that our upper arms are fairly even with your body, so making sure you're not reaching forward excessively as you sit. And then make sure you're sitting back in the chair. So we want to use the backrest, and then consider using a lumbar support there as well. All right, so moving on, we're going to kind of talk about adjusting the monitor a little bit. So with the monitor, what we're looking for is or the first thing that we want to do is adjust the monitor height. So when we sit in that, position that we just talked about, so your bottom's back in the chair, your shoulder blades are back, shoulders are relaxed. With your head pretty level, we should be right about at our eyes should be right about at the top of the screen there. You can use a monitor riser, books, reams of paper, whatever, to kind of get that height right. Now, if you wear like a bifocal or a progressive lens, the recommendations are a little bit different. We want to make sure that you don't have to, extend your head or look up excessively to see out the part of your bifocal that you need. So typically, when you use a bifocal or progressive lens, you want the monitor positioned much lower than if you don't wear those types of glasses. So how much lower, I can't really tell you because it kind of depends on your glasses. But basically, you want to be able to sit in that good posture that we talked about, look straight or keep your head level, and then kind of just look down using your eyes through the bottom portion of that glasses. And then with that, the middle of the screen should be in focus. And you just have to kind of play with that height to find out what works best for you. Because again, depending on where that line is or where the lines are in your glasses, that'll depend on where you need to put it. So the next thing that we want to do is we want to center the monitor. And really, it's pretty easy to do. We just want to make sure that the middle of the monitor is kind of lined up with the middle of the keyboard, and that's lined up with the midline of your body. So you should be able to draw a line like down your nose, kind of right down your sternum, kind of right through the middle of the keyboard, and then right up through the middle of the monitor. And then the last thing that we want to do with the monitor is adjust the distance of it. So in general, I tell people to put the monitor as far away as you can and still see the screen clearly without squinting or straining, because the further away we have the screen, the less head rotation we have to have. So you might as well put it as far away as you can. But just make sure that it's not so far that you have to squint or kind of do any sort of funny contortions to adequately see the screen. So usually arm's length is a pretty good place to start, and then just sort of adjust from there. All right, so what if you use more than one monitor? The first thing to do is really, if you can, try and get monitors that are of a similar size. Like sometimes I'll see people use like a big, 22-inch monitor with a 13-inch laptop beside it. And, you can certainly do that. But the problem with that is you go back and forth between those monitors, puts a lot of strain on your eyes. Just having to constantly readjust as you switch between the two. And then, not only is the eye strain not good for your eyes, but it typically will force people to kind of do some funny things to try and see things more clearly. So they may kind of strain forward, they might kind of sit forward in their chair more often. So really try and get those monitors of similar dimensions. So adjust the height the same as you would for a single monitor. So if you don't wear bifocal progressive lens, you want to have your eye level right around the top of the monitor. If you do wear those types of glasses, you want to have it a little bit lower. And then in this case, we're going to line the center of your monitors up with the midline of your body and the midline of your keyboard. So kind of like we talked about with the single monitor, where the middle of the monitor is sort of lined up with the midline of your body. Now we want to line up the middle of those two monitors with the midline of your body. So in that top picture, you can kind of see just where that dashed line is, right down the middle there. It's lined up with the middle of the keyboard, and then that line should line up with the user's sternum, so right in the middle there. There are a couple of exceptions to this, and we're going to talk about some sort of specifics later, and we'll get to it. But if you're someone that really uses one monitor for like 90% of your work, and the other one, maybe you just have a calendar open, or you have something that you don't use very often open, but most of your work is done on one single primary monitor, you want to kind of line that monitor up with the midline of your body. So since you're there most of the time, we want to make sure that it's set up best for you. So that would be the exception. But usually I say, like, if you somewhere around 80 to 90% of your time is on a single monitor, line it up that one centered with you. If it's any less than that, I would recommend that you go and line both monitors up with the midline of your body. Keep in mind, working with multiple monitors, you may need to position yourself further back from the screen. So, you know, that gentleman on the bottom there, that's probably pretty unusual to have that many monitors, but it does bring up a good point that the closer or the more monitors you have or the more real estate that those screens take up, the more you're going to have to turn your head to rotate to see it. So you're going to put a lot more strain on your neck and upper back if you're too close. So kind of like if you're in the movie theater and you're sitting in the front row, you kind of have to turn your head a lot to see the screen. Whereas if you sit further back in the theater, you don't need to move your head as much. Similar stuff at work. So, you know, if you have very large monitors or maybe you do have 3 monitors, something like that, you probably want to sit a little bit further back than you would otherwise, so that you don't have to put as much of that neck rotation into play. All right, so when we talk about the keyboard and mouse, really the big thing with here is getting that seat height right. So like we talked about when we adjusted the chair, if we can make sure that the height is right, that's really the big thing, because that should put our wrist in a good position there to use the keyboard and the mouse. If we can't, for some reason, get that height right, you know, by adjusting the chair, we may want to consider using a keyboard tray, that, you know, one of those things that comes out from the bottom of the, or from underneath the desk that you can put the keyboard on, just to give yourself the ability to get that wrist and upper extremity position correct. You know, sometimes we can do it by adjusting the chair, but sometimes it's just not possible given the height adjustability of the chair relative to the desk height. The next things with keyboard is really recommend that you avoid the feet on the front of your keyboard. So try and keep your keyboard flat on the desk. The reason for this is when we extend our wrist or kind of lift it up from that, like if we were typing in our hands in a palm down position and then we lift your wrist up, it's called wrist extension. But really don't want to be in that position too much when we type. We want to have our hands relatively flat as we type. So I'm not sure why those feet on the keyboard are on there, but I do recommend that you keep those flat as you're typing. In most cases, you know, any kind of ergonomic or specialty keyboard really isn't necessary as long as you can get the height of the desk right. So, you know, sometimes they're a little bit more comfortable and people like them a little bit more, and you can certainly, you know, try them. But in most cases, they're not necessary. There are certain people that, you know, do have things going on where you know, they do work pretty well, but for most people, you know, they're not necessary. And then the last thing is the use of wrist rests. So, you know, those are the small pads that run in front of the keyboard. You know, typically they're foam or beads or something like that. Those are really sort of optional. There's not really a recommendation for or against those. So if they're comfortable for you, you know, you can certainly use them. The one thing that I will say is sometimes just when you're trying to get that height right, it may help you out if you can get a little bit more height. So like if you find yourself extending that wrist or lifting that hand up away from the keyboard too much, just because of the position of your desk, you might want to try the wrist rest to see if that helps to kind of flatten that angle of your wrist out a little bit. All right, and then, so the next thing we want to do is adjust the mouse. So with the mouse, we want to really make sure that it's positioned as close as possible to the keyboard. So, you know, whatever distance you can eliminate between the edge of your keyboard and the mouse, we want to do that. And we want to try and position that mouse so you don't have to reach for it. So the elbow stays kind of at your side as you go. So think of that as more of a rotation movement than a forward reach movement. We want to try and eliminate or at least minimize that forward reach. So our elbows should relatively stay at the side as they're in front or as they're using the keyboard. you should be able to just rotate from your shoulder to access the mouse without reaching too much. And the next thing we want to do is consider the size of the mouse. And I will tell you that most of the standard mice that people have or use are too small for their hand. We really want the mouse to sort of fill that hand. That kind of takes away some of the real fine motor movements that we have to do with our fingers and our hand there. It puts it more into the bigger muscles of our forearm and our shoulder. If we can kind of take some of that stress away from those smaller muscle groups, that's a good thing. So you can see in that first picture how that mouse really fits the hand. Now, I said with the keyboard there wasn't a huge advantage to like an ergonomic keyboard or a specialty keyboard. The mouse, it's a little bit different. So there are some really good designs out there that place your hand into what we call a more supinated position. So think of as a palm down position as your normal mouse position. If we go to like a handshake position, like you would be getting ready to shake someone's hands, where that palm is facing the inside or facing your body a little bit, I guess. As we move that direction, that's called supination. So moving more towards a supinated position is going to put you in a little bit more comfortable working position. It's also going to take some of the strain away from your hands. So you can see in this top picture how we've gone to a little bit of a supination or a supinated position there. And in this bottom position, he's got a lot more into that position where he's almost in a, fully in that handshake position. There's not really a, anywhere 30 to 50 to 60 degrees is usually what's been shown to be a little bit more effective, but you can certainly kind of play with that to see what works best for you. But finding one that fits your hand or fills your hand a little bit more, and then moving away from that straight palm down thing can really be a good idea. In the wrist pads for use of a mouse are a little bit different. There actually has been some research that supports not using them for in front of the mouse. Just the way that you use a mouse and having that pad in there actually puts a little bit more stress on the carpal tunnel area than we would if you don't use one. So the recommendation is to for most people is to not use that wrist pad in front of a mouse. Okay, so the last thing that we want to look at is consider the lighting. This one really just want to be careful in terms of glare, because again, glare is going to create more eye strain, not good for your eyes, but also going to put more strain on your body by forcing you to compensate to see the screen a little bit better. So just pay attention to how the monitor is positioned relative to the light sources that you have. Really a couple things to be aware of is kind of be aware of the area behind the computer. I know now a lot of people are working at home, still have a little bit more access to natural light, which is a good thing. But if you have your computer positioned like so you're looking out your window and your window is right above your computer, that's going to create some pretty big issues there in terms of glare and in terms of visual strain. So try and have your computer screen placed at a right angle to any sort of windows or anything like that. And then, consider task lighting when possible. So this is more, in the work environment or the on-site work environment where you have that harsh overhead lighting. A lot of times that can create some glare issues, as well as just some other visual issues in general. So if you can kind of turn that down, dim that, then use task lighting, that can be helpful. And then, certainly play around with the brightness settings on your computer to kind of help you out a little bit. Ooh, backwards, sorry. Okay, so that's a typical office environment. But what if this is your office now? So, you're no longer going on site, you're kind of working at home. The good news is that all the stuff we just talked about, the same things apply. The bad news is you might not have access to the same sort of equipment, resources, or anything that you had at your office on campus. A couple things to consider there when we are working in a home office environment is, really we want to try and find a dedicated work area. And that's not so much about ergonomics as it is about productivity, but really trying to pay attention and find an area that you can minimize distraction. Pay attention to the lighting that you have. So we already talked about that, how you position your computer, staying away from looking out the window and trying to stay at a right angle to any sort of light coming in. Try and have a firm work surface, so really have access to a desk or a table at least that you can firmly press into as you need it. And then try and have a good chair. We'll talk a little bit more about that, but really looking at what you're sitting on to kind of minimize the risk of injury there. Next thing we want to do is look at the type of work you do. Is it pretty much all computer based? Do you have to use the phone a lot? Are you reviewing paper documents, anything like that? Those things all have an impact on what sort of workspace you need. And then the last one that's really important at home, knowing that you might not have the availability of some of the, like a good chair or a keyboard chair, things like that. We want to identify these alternative secondary work areas. So you may have an office with a desk and just about everything else that you need in it that you work at most of the time, but try and find some spaces that you can work in other than this. So maybe you set up a standing station at the kitchen counter, maybe you have an area in your bedroom where you can work in a semi-reclined position, but trying to scope out some different areas that you can use throughout the day to kind of break up some of those postures that you're in your primary office is a good idea. Okay, when we talk about work from or working remotely, the biggest problem is that most of the people at home are working on a laptop. So these are great devices and really give you a lot of portability. And when you're working on a laptop for a short period of time, it's a really great resource. But from an ergonomic standpoint, they're not really that great. And it's really just because of the design of them. The keyboard is matched to the monitor. So that really makes it impossible to set up a laptop and give yourself a good ergonomic experience. So we can either set the keyboard in a good position and then like the gentleman on the left, but then our neck and our back are compromised. Or like the lady on the right, we can be in a little bit better position in terms of the head and neck, but our wrists and our shoulders are in a horrible position there. So there's not really a way around that positioning difficulty unless we use an external keyboard or mouse. So this is for people that are working from home or working remotely a lot, where you're not just in the airport sitting down for a little bit kind of working on your laptop, but doing dedicated work on a laptop. Really recommend that you get an external keyboard and mouse so that you can split the keyboard from the monitor. This allows us to put the monitor in a good spot and then put the keyboard and the mouse in a good spot. And then these keyboards are available at just about any retailer, at Amazon. The thing is, you may want to consider doing a wireless one, just because it does make it a little bit easier to position things as you need to. And then once you get this split, you can really do any of the things in terms of adjustment that we already talked about. So in terms of working from home, that's really what we want to make sure that we do. Okay, so for secondary workstations, if you can, try and build yourself a secondary or a standing workstation. Really, a couple things to keep in mind is we want to make a work surface that sets your forearms parallel to the floor, and then keep your wrists relatively straight as you're typing. Here, again, this is a secondary workstation. You're not going to be there for hours and hours on end, so it's not as important to split the monitor from the keyboard here. So we can work off of our laptop, but just tilt your monitor top so it's away from you, probably a lot more than you think you should. And then keep your shoulders relaxed, your head relatively neutral, and just kind of look down more with your eyes. And for a short period of time, that'll work out great and get you out of that sitting posture for a period of time. Another position that I really like to have some people try is what we call reclined work, where you actually sit, in a little bit more reclined position, and then, have your feet up, and then this really kind of just gives you another set of postures that you can work on. It also is going to provide a lot of support to your back as you're working. So for most people, it's pretty comfortable. Just recommend that you use a small pillow towel in your lap under your computer, just so you don't have the heat going right on you. And then here in this reclined position too, I'd recommend that you at least think about using that lumbar roll behind your lower back. That can be helpful. And then the last thing here is remember to move often. So I'd say no more than 20, 30 minutes in these secondary work postures. But again, they will give your body a much needed break from that primary posture. Okay. And I know we're getting a little short on time, so we might have to cut some of these off. So these are just a couple of examples that I wanted to kind of point out some things, and hopefully that'll give you a little insight of some things that we look for. So this gentleman, we kind of looked at. So a couple things that I see here is, this desk height is much too high, or the chair height's too low, any way that you want to look at it. So we really want to get his chair up a little bit. You can't necessarily see it in the picture, but what that'll do is that'll bring his feet off the floor. So we certainly want to have him use a box or a footstool, something like that. But we're looking to try and get his forearms parallel to the desk there. That's going to be a much better position for him. The other thing with this is, since he does use 3 monitors, we're going to want to give him a little bit more depth. So he did have a little bit more room on the work surface, so we could push them back. But if we couldn't do that, we might want to actually look at a keyboard tray, something like that, to give him a little bit more depth. Okay, this one is a little bit more challenging. This is what this person had available at home. So you can kind of see in this picture on the left, that mouse is pretty far away from the keyboard there. So that's going to give, or that's going to create some problems in the shoulder and in that right upper extremity as she uses that mouse. You can also see that her elbow is actually a little bit behind her body. So that's telling me that her shoulder's extended there. It's not a very good place to be working from either. So we certainly want to try and fix this by getting her somewhere where she can have a little bit more of a work surface and put that mouse closer to her keyboard there as she worked. The other thing is, this is obviously not a very good chair. She didn't really have access to many other options. So what we did is talk about trying to use some cushioning. So toweling the seat to just provide, so she's not sitting on that hard plastic, and then using a very small lumbar support there to try and put her spine in a little bit better position, would hopefully be helpful for her. Okay, so this one's a little different, actually. This is a before and after picture. So the before here is without the keyboard tray. The one on the right is after, but before I got the chance to adjust it again. So you can kind of see on this one on the left how she has to reach way, way forward for to get access to that mouse. So that's certainly created a problem for her. Puts a lot more strain on her shoulder. And then just the way that she had to do that, it put a lot more strain on her thumb. And you can see she has that brace on her thumb already. So what we did is we added a keyboard tray to her desk. Now this keyboard tray should come way, way down. So the tray is height adjustable. So we would want to drop that way down so her feet are on the floor. And then that's going to put her in a much better position so that she doesn't have to reach forward so much for that mouse. We would also knock down these armrests. They're all the way up. We would want to actually go the other way and get those completely out of the way. That'll allow that elbow to be close to her side as she's working. And then we went to a different type of mouse that's going to put her hand in a more supinated position, better support her thumb. So hopefully we can take some of the strain off of that. Okay, this one is someone that's working at home, and they started on the left to really, like they said, okay, I want to get my forearms parallel to the floor, get my chair height in a better position relative to the desk. So they brought their chair way up. You can see they're supporting their feet on a foam roller, but they're getting some pressure on their thighs from the desk surface. So You can also see that like the size of that gap in there is really not supporting his legs at all. So here, what we did is we couldn't put a keyboard tray on because he's at home. But so what we did is just have him using a lap tray. So it just kind of sits on his desk and effectively lowers the height of the keyboard and the mouse, lets him sit on the floor. And then we also, he actually brought his chair from work home. And so it's an adjustable seat fan, so we could move that forward to give him a little bit more support. Okay, so we'll do one more. So this one, I blacked out her face, but her eye level is right at that red line. So you can see that that monitor is much, much too low for her. So we want to raise that monitor up a little bit, but we also want to raise her chair up a little bit. You can see how she's kind of shrugging her shoulders up there as she sits. So we certainly want to raise that chair up. The other thing that you see here is this lumbar support is not really effective. So we want to kind of change how she uses that, or change the actual support and then how she uses a little bit more to make sure she's supporting her lower back. All right, so we'll just skip that last one. But that's all I have. Hopefully having a little bit of time for some questions. I guess I'll try and figure this out. I think I'll just stop the share and then go from there.
Thank you so much, Jamie. That was super informative. I think we can all take something away. So we had a lot of questions come in, so we will get through as many as we can. And if you are able to, Dr. Beadle, I could email you some of the ones we don't get to. You could type up some quick responses. I could email them out to everyone.
Sure, absolutely.
If you have the time for that. All right, let's see. Our first question is, where should double monitors be placed when wearing progressive lenses?
So we would want to adjust the height first. So with the progressive lens, if you're sitting in a relatively good posture, you want to have your head level, and then if you look straight out from your eyes, probably want to start dropping the monitors about 3 or 4 inches below that. And then keeping your head level, just look through the bifocal or the progressive lens that you use on the computer and see how the focus is, and then adjust the monitor up and down from there. But really, they should be much lower than you think. Is really the best answer there. And then you just kind of have to play with the height exactly, just because it depends on where that line is, where you need to put it. In terms of the vertical position, it's the same. So they should be relatively centered. So line through the middle of your monitors, line through the middle of your keyboard, lines up with your sternum.
Great. Our next question, my monitor does not allow for height adjustment, but can be tilted at different angles. Should I tilt it so that it lines with my eyes?
Well, it kind of depends. So if you need to raise your monitor up, then I would recommend using like a book or even a monitor riser, something like that underneath it, so that raises the monitor up a little bit. If you need to go the other way and you need the monitor lower, I would try and see if you can actually get your seat up a little bit higher. So like, you're essentially lowering the height of the monitor there. But you're by raising yourself, you're going to effectively lower that monitor. If you can't do that, you can try and adjust the tilt a little bit. So like if you tilt the monitor back a little, so the top of the monitor is positioned back a little bit, that's what you can try to get that there, but that's going to be tough to do. And a lot of times, like Macs they don't have any height adjustability built into it. So if the tilt doesn't work, you might have to look at adjusting desk surface or doing something a little different there to get that height.
All right, we'll do just a couple more. Should I adjust the height of the armrests so that they are level with the desk?
Well, armrests are really sort of a matter of personal preference when you're actually typing. So I recommend people have them just to help getting in and out of the chair. But when you're actually typing, or kind of using your computer, it's really a matter of if you like them or not. So if you do keep them, excuse me, what I recommend that you do is like sit back, sort of like we talked about, so in a pretty good position, so elbows at your side, forearms parallel to the floor, and then raise the monitors so they, or I'm sorry, raise the armrests so they just kind of graze the very bottoms of your arm. Like, you just want to be careful that you don't have them so high that they push your shoulder up. You don't want to have them so low that then that a lot of times leads people to lean to the one side or another. So you know, in a good position, they should just sort of kind of kiss the bottoms of your elbow there. They shouldn't really notice it too much, but just gently graze up against it.
Wonderful. Right now, I see we are at time. Dr. Beal, are you able to stay for an extra minute or two?
Yeah, I'm good for a couple more minutes.
Okay, we'll just knock some more of these out.
Sure.
All right. Do you have recommendations on some stretches for alleviating pressure on your spine throughout the day?
Yeah, I mean, that's a little bit tougher because, but just in general, so, you know, assuming you don't have any sort of medical conditions that you'd want to be a little bit more careful with that. I mean, some of my favorites are like the cat-cow, you know, where you start out on quadruped or on your hands and knees, and then just kind of trying to rotate your hips or your pelvis up and down, and sort of in that cat-cow position there is one of my favorites. And then the other thing that I, you know, think is a good idea, especially if you sit all day, so you know you don't have access to a standing station, and if you think of that posture that we're in, we're kind of, you know, our hips are flexed up, kind of we're kind of in this forward position there, our shoulders are rounded. If you just lay on your stomach and then like from there push yourself up, like, but keep your hips down, so almost like you're doing a press up or a push up, but your hips stay down, so you kind of, we're just reversing that position that you were in sitting all day. So that puts your back, that kind of reverses that position, that uses some areas in your shoulder that we're not actually using. So that's a good one. That's another yoga move too, but I can't remember the name of that one. But yeah, those are a couple of good ones. You know, another one that I like is kind of a rotation. So, you know, if you kind of can, trying to think of the best way to describe this, but like, so lying on your side, like, so let's say you're lying on your right side, and then you can try and keep your legs down and rotate your shoulders back to the left, and get a little bit of rotation through your spine. That's another one that can be helpful.
Great, all good suggestions. We'll do just one more. Do you have any advice on using an exercise ball as a chair?
So I'm not a big fan of them, certainly not for a primary posture. So, you know, or a primary workstation. So certainly would recommend that you have a chair or something stable that you work most of the time. Like we talked a little bit in the working from home, but, you know, at work, you can certainly adopt secondary postures as well. And you can use it, you could use an exercise ball there too, just to give yourself a little bit of variation to how you're sitting through the day. But again, I would really recommend making sure that you have a chair or a stable surface to sit on.
Great. Well, we will go ahead and wrap it up. Thank you so much, Dr. Beal. This presentation was wonderful, super informative. We can all take something away from it. And to the attendees, you all will be receiving an email from me in the next couple of days. It'll have some follow-up responses to the questions, as well as an evaluation. If you would take just a few minutes to fill it out, it helps us better our future programming, and we would greatly appreciate it. And everyone have a great weekend. Thank you.
Thanks, everybody. Bye.
Bye.